what I start with is we first take a look at what they eat. And if we see big issues there, I correct them there. And if they want more, I send them to a dietitian. So diet. It's got to start there. Then we take a look at their exercise. Exercise is a very underutilized form of helping these things because I don't think people realize the benefit. And let me give you an example of that. If we take patient A, who is a non-smoker but also unfit, and we have patient B who smokes but who is fit and does regular exercise, they actually have equal risk of heart disease, meaning that fitness can overcome the detriment of smoking. Exercise is hugely important. And I mean, we try to say, yes, we want to lose weight. Yes, we would like them to lose weight. But what I really want them to be is fit, because fit is dramatic, and we have many studies to show decreases the risk of heart disease and strokes. Third thing, good sleep. If patients are not sleeping well, they feel terrible during the day. And you add on some high stress to that with their jobs and so forth. So we look at their sleeping. Because if people can get regular sleep, they feel better. If they feel better, they're more motivated to do the things that we discussed previous to that. Fourthly, regular visits to the doctor. There's no way that I'm going to have a chance to help with their high blood pressure and high cholesterol if they don't ever see me. And I think a lot of people just kind of stick their head in the sand. If I don't know about it, it's not going to happen to me. Unfortunately, that's not the case. And I have found that living in North Carolina, I will occasionally get people that come see me that are farmers. And they'll come see me and say, I haven't seen a doctor in 30 years. And it's like they want me to give them a big high five. Well, good job. Now, let me tell you about your diabetes, your high blood pressure, and all these other problems. We don't want that. We want to prevent that. So I recommend regular doctor visits. And the sort of fifth and final piece of this puzzle is I tell people that in order to help all these things happen, a strong faith is what sort of cements this all together. I think many times if people are very haphazard with their faith, very haphazard with how they handle and deal with God, that it shows up in their lifestyle and all these other areas as well. So I encourage them to evaluate and look at that. God is a person that hears our cries. He wants what's best for us. And if people sit down and ask God for assistance, He'll do that. And He will help people, again, make the impossible possible.